Hello, I'm Dr. Lola Ashaye, and you're listening to Connecting the Dots with Dr. Ashaye. Many people with prediabetes and diabetes desire to lower their dependence on medication, but they also have difficulty doing the consistent lifestyle changes that actually will help. And it's because some don't understand how lifestyle changes work, but sometimes it's just because the steps, they're not really clear about how to go about it so that it will be successful. They kind of know what to do, but maybe not how to do it. So I had a new patient recently. She was aware she had diabetes. She had known it for years, and she had decided to stop her medicines for a few months. And she wanted to control with lifestyle changes instead. And during that period, she stopped, checking her blood sugar consistently. And since she felt fine, she started to, she just didn't address her diabetes at all until she started to have numbness and tingling of her extremities. So we got some labs, and during her first visit, that's when we found out that her A1C was 12. So that means her average blood sugar is about 300. Normal blood sugar is 100 to 115. So, at this time she had, her average blood sugar was very high, and she wasn't checking. She didn't know. All she had was the symptoms. So unfortunately, this is not uncommon because many serious conditions don't cause significant symptoms until later in the course of the disease. And unfortunately, it's when we have pain that we tend to respond and try to do something about it. But the problem with conditions like diabetes is people will experience pain if it's not controlled, but the pain is delayed. It comes later in the course of the condition. The unfortunate thing, though, with things like diabetes is that it doesn't only cause delayed pain, but prolonged pain. Like when it gets complicated, it becomes very difficult to manage. It causes a lot of really serious symptoms. It's much harder to treat. And because at that time, the damage to the organs is usually permanent. So what we're going to talk about today is practical tips that you can start learning how you can naturally lower your blood sugar. I've found that many people have a good idea of what to do, but they don't really know how to do it successfully. And the how can be challenging, and that's what we're going to talk about. And we're just going to lay some foundation today. Okay, so again, you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land in Texas. And at InTouch, we help you more easily become and remain healthy because you have direct, easy access to a doctor. And we want that so that you can live fully and enjoy doing what you love. If you're a business owner, if you're an international visitor, if you have a high deductible, or even if you don't have health insurance, our services are perfect for you. So come check us out. Okay, so let's get to the topic of the day, prediabetes and diabetes. These are one of the most common conditions that I manage. And over the last, over 15 years now, I've been a doctor. I've seen so many people at so many different stages of diabetes. And a common theme is, when people first get diagnosed, many people don't want to take meds. They want to do the lifestyle changes. But what I've found is many struggle with the lifestyle changes required. And part of it probably is how it's presented, because a lot of times, in a rushed doctor visits, you don't have all the time to explain, what's all that needs to happen. And so people may just hear, don't eat this, don't eat that, exercise, sleep well, but they don't really know how to go about it. And so they struggle with making those changes. The other thing I notice is a lot of people think it's something they can simply just, oh yeah, I know I need to eat better. And they're just going to suddenly, after 15 years of not eating well, they think they can just discipline themselves to start eating better. And I think, sometimes just minimize how much it takes, how much mindset work, how much, discipline, how much is needed to really make change I think sometimes as humans, we underestimate how much we need help to make change. And so that can be a factor. And what I found is for sustainable lifestyle change, it really takes three things, which I'm going to share today. And of course, it takes other things too, but I'm going to share the three things that I think are really important. First one is commitment. The second one is understanding that it happens over time and understanding that it often requires accountability. So I'm going to talk about commitment first. So for sustainable change to happen, for someone to sustainably lower their blood pressure and their blood sugar, commitment is required. A lot of times when I discuss lifestyle changes with people, many times they are telling me what they need to do. Oh, yeah, I know I need to reduce my processed foods. Yes, I know I need more vegetables. I know I don't drink a lot of water. But they leave saying those things and they say, oh, yeah, I'm going to do better this month, without really coming up with a plan, without really knowing how they're going to do better, without really questioning, how come I wasn't doing this, 15 for the last 15 years? Why do I think I can automatically just start doing it today? So not giving it the attention that it needs, just really trying to gloss over it and think it's going to be really easy and they're just going to do it, and, making a commitment really needs to be intentional, right? It means that you would kind of think about it and decide, okay, what am I going to really work on this month? What am I committed to working on? If I really want to lower this blood sugar, what do I know that I can do, that I can practically do? Like what kind of goal should I make? So it takes some thinking about it intentionally, and thinking about why also. Why do I want to lower my blood sugar naturally? Is this really practical for me? Is it because I want to live a long life and be able to see my grandkids? Is it because I am in pain now and I know if, my sugars are lower, my pain is going to get better? Is it because I just want to feel better? Just really connecting why you're trying to make this change and thinking about it and being much more intentional. And then that would really help instead of just kind of glossing over all the things you think you should be doing and not doing. So my recommendation is, when you come up with a decision, when you're truly ready, make a commitment to doing one thing and write that decision down, review it often, and then connect it to why you want to make that change. And then, we can go on to the next step. So that would be the first thing, make a commitment and then make sure you have a why to back it up. It makes it feel more worth it. The next thing I'll say is give yourself time and space. Most sustainable changes don't happen immediately. So you could do something for a few weeks, maybe even a few months. But if you want to do something for a few years or years lifelong, then it's going to take some time and you're going to need you're going to need to give yourself that time. So it's unlikely that you started off with an A1C of 9, you got to an A1C of 9 in 1 month. So it probably would take, years of changing your lifestyle to get to a healthier state. And that means setting practical goals and tracking those goals. And then when you've accomplished one goal, a little goal, you go to the next step and you're aiming for improvement instead of perfection. So you've done the first thing, you've made a commitment, you have a why, you want to, I want to lower my blood sugar because, and you really connect to that. And then your next step will be coming up with a goal, a SMART goal of what exactly you're going to do. And it could be as simple as I'm going to eat half a plate of veggies with every meal or with one meal for the next, 1 month, with one meal a day for the next 1 month. And you want to track it. Did I do it on this day? Did I do it on the next day? And you want to make sure that you are actually keeping up with the commitment that you made and connecting it back to your why. And I know a lot of times we're still going to get into the more, the actual things or the healthy tips that you can, healthy practices that you can engage in. But I want to talk about this first because, like I said earlier, when I talk to many people, a lot of them already know. They know what they're supposed to be doing. They're just not doing it yet. So they don't really know, but they know what in their heads, but they're not doing it yet. So I wanted to just take some time to figure out, help people with the how part, because there's a lot of information about the what online, but people get stuck on how. Okay. So before I get into the last one, thank you for all of those who have subscribed. I really appreciate your support, and you're also helping many others learn information that could really improve their health. So if you haven't already, please go ahead, subscribe, share, and like. That will help other people learn about us and learn about how to improve their health. Okay, so the third thing I want to share about is accountability. And I found that a lot of us underestimate the power of accountability, but we use it all the time. We've seen it work successfully in our lives many times. I mean, many people, they go to work on time because they know that if they don't, they won't get fully paid, or if they do it long enough, maybe they won't have a job. Even for things that are seemingly not as important, maybe you promise to meet a friend for lunch, you show up, because you value their friendship. There's some kind of accountability there. Or you promise to do something with somebody, most of us will tend to show up. So we do many things even when we don't feel like it because we've given our word. And so in the same way, we can intentionally make ourselves accountable when it comes to our health. We can do this by working with a doctor, a nutritionist, a trainer, a health professional. And when we make ourselves accountable for health behaviors, we're so much more likely to actually follow through. And that's why, when we look at, for instance, if we talk about achieving a healthy weight, many people that sustain a healthy weight long term do it as part of a program. And that's because that accountability is very important, especially when you're trying to do something new or make a change or you're trying to grow. And especially when you do that accountability with a professional, it makes the journey a lot easier and you're so much more likely to reach your goal. So commitment, make sure you give yourself the space and time to grow and also get some accountability. So if you have diabetes and you're really interested in lowering your blood sugar, you can use these steps. You can start with already what you know, commit to doing something, give yourself the space to grow, do it in baby steps, and then find some accountability. And, it will make a difference so that you don't find yourself in the same condition, 2 years from now. And if you're in the Houston area and you have diabetes or any other health condition and you're looking for a primary care doctor who is proactive about your health, we're here for you at InTouch Primary Care. You can learn more about our services and how we can help you on our website, or you can call us 713-280-9985. And we look forward to helping you on your journey to better health. So diabetes is a serious condition. It can lead to so many complications. But the good news is at the early stages, it can be very easy to reverse. So it's when it becomes, when it's been there for a long time and it's been uncontrolled, that it tends to cause a lot more problems. So you can start with the simple things you already know, commit to doing them, give yourself some grace, plan, make yourself accountable. You will be preserving your organs. You'll be reducing your risk of many serious conditions, and you feel better. You have more energy, and you'll be able to be more productive and enjoy your life. These things are priceless. So I hope that helps, and I will see you again next week.